Even though this has been another terrible, horrible, no good, very bad day, we don't want to forget the Friday afternoon's big Rose Garden event at the White House. President Trump gave us the first stage of a plan that will hopefully help us mitigate the damage from the coronavirus outbreak. He announced a set of public-private partnerships between the government and some of our nation's largest companies, and I like that. Okay, so it wasn't exactly the Marshall Plan that I've been calling for, but it's absolutely a step in the right direction. There were some big names up there, including one of our favorites, CVS Health, which will be donating space in its parking lots nationwide for COVID-19 testing. On top of that, CVS has rolled out a series of initiatives to help with the outbreak, broadening access to medication, telemedicine visits, working with local governments to take care of patients who show up with coronavirus symptoms at the company's Minute Clinics locations, and, of course, bending over backwards to keep their employees safe and their shelves stocked. Long story short, as a major drugstore and a major health insurer, remember, they own Aetna. This company's an essential player in any kind of response to this pandemic. So let's check in with Larry Merlo. He's the president and CEO of CVS Health to learn more about his company's contributions to the cause. Mr. Merlo, welcome back to Mad Money.
Jim, great to be here.
All right, Larry, give us some perspective. Give us some context. Where are we in this pandemic, and what is CVS doing to help us?
Well, Jim, first of all, we're in a unique position to help address the pandemic, given our physical presence in communities all across the country and the ability to reach millions of consumers with local solutions. And, you think about the health, the safety of our customers, our client members, and certainly our CVS colleagues. That's our number one priority, and we're taking the necessary steps to ensure their well-being. And we've got key leaders across each of our business units. They're working to maintain business continuity in order to meet the needs of consumers, clients, and communities we serve. And, we ask ourselves every day, is there more that we can do? And, Jim, I think we're in the early stages. I think we've seen from Dr. Fauci and other clinicians that, we have the risk of this getting worse before it gets better. Right. But there's a lot that is being done in many places, many industries across the country to gain control and put this behind us.
So, Larry, do you envision a world where in one of your multiple CVSs there'll be some sort of line, like almost like a car wash, I guess, where you can get a quick test? Is that the right appearance that I've got in my brain?
Well, Jim, as a leader in healthcare, we've had regular contact with White House key leadership on the Hill. And I think it's important to acknowledge that as we sit here today, this is no longer about politics. It's not about competition. It's about companies working together to be part of the solution. And in this case, how we can make testing more broadly available. And, we've had a series of calls throughout the weekend, again today, working out the details. And the testing would take place in secure areas of parking lots, not inside stores. And individuals being tested will not have to leave their cars. I think one of the important things, Jim, that has been discussed is, defining the testing protocol and the fact that, the individuals that would be prioritized would be healthcare workers, first responders, and those over 65 with the symptoms of fever and respiratory distress. But, many details have been worked through, but there's more details that need to be developed to get these sites up and running, as well as working with the state officials to accomplish that as well.
Okay, today, Rite Aid had an analyst meeting. They talked about their same-store sales, and it does seem that, but the combination of what you guys do for a living, plus your excellent Caremark division for largest mail operations in the world, which I use, that this is kind of, look, no one's a profiteer, but your combination of the same-store sales and the Aetna must be producing something that's pretty good for CVS.
Well, Jim, we have certainly, in our retail business, we've seen a very large demand across a wide range of items and categories. That no surprise, cleaning supplies, sanitizers, people restocking their medicine cabinets. And, we're in daily contact with our suppliers and looking at creative ways to fulfill that demand as we respond to orders. There's going to be some spot shortages of product, but we're doing everything that we can to get that product to the shelf as quick as we can. Yeah, and you move over, Jim, to our Aetna business. We've taken probably 5 important steps when you think about the combination of CVS and Aetna. First of all, we've waived charges for home delivery that enable individuals to receive their needed medications and products while remaining in the comfort of their home. We've waived out-of-pocket costs for all diagnostic testing related to COVID-19 for our Aetna members. We're offering zero copay telemedicine visits for, Aetna members, not just specific to COVID-19, but with the goal of limiting potential exposure in physician offices. We've waived early refill limits on maintenance medications. We're offering 90-day maintenance refills for insured and Medicare members. And, finally, we have a program that we call Aetna's Healing Better program. And members who are diagnosed with the virus will receive a care package containing CVS OTC medications to help relieve symptoms, along with cleaning supplies to help keep others in the home protected from exposure. So there's a lot of activities, Jim, going on. No question, again, we're seeing a lift in retail traffic, but we're also incurring additional costs with the various initiatives that we're implementing, such as waiving copays or eliminating out-of-pocket costs.
All right. And also, Larry, are we able to feel somewhat confident about the supply chain for our drugs, given the reliance on China?
Yeah, Jim, great question. And, we have not experienced any disruption to date, and we have been in close contact with our suppliers. They actually tend to carry, on average, a 3 to 6 month supply. Jim, you think about the fact today that about 90% of all the prescriptions that are dispensed across the country are generics. And, we do have the size and scale through our partnership with Cardinal Health. We created the Red Oak sourcing model. And as a result, we've actually been able to diversify our generic supply chain so that we're not dependent on any one manufacturer for a particular product.
All right, that is great news, because a lot of us we're quite concerned about that. Finally, are you happy about where things are? That's the wrong word. Do you think things are going okay between the public partnership and private partnership with the government and with your company and others?
Well, you know what, Jim? As I mentioned earlier, this isn't about competition. It's about companies working together, against a common cause, looking for a solution. We've been in constant communication with government officials. I think it's clear that all parties are focused on solutions, and I think it's also clear, Jim, that the public-private partnerships continue to be a powerful force in times of need, and that's certainly what we're experiencing with the virus.
Oh, I'm so glad you said that, Larry. The cynicism is so deep. I think that business is the greatest source of social change in this country. It's companies like what you're doing that are great. I want to thank Larry Merlo, President and CEO of CVS Health, symbol CVS. Great to see you, sir, or to talk to you at least. Mad Money's back after the break.
Don't miss a second of Mad Money. Follow @Jim Cramer on Twitter. Have a question? Tweet Cramer. #MadTweets. Send Jim an email to madmoney@cnbc.com or give us a call at 1-800-743-CNBC. Miss something? Head to madmoney.cnbc.com.